Patients are always asking me if we accept gifts. Donuts, Rockland's barbecue, cold hard cash, Starbucks cards. I always say no, the pleasure was all mine. But what do we do when a patient gives you a gift that keeps giving? I'm not talking about free refills for life at your favorite fast food joint. I'm talking about something even more mightier. The gift that keeps reminding you it's there. And no matter how you try to reject this offering, it always ends up in your bag. Actually, it ends up in your pants, not the pocket part. You have no idea what I'm talking about. Well, I'm talking about mites. Oh, wait a minute. You may know them by their really cute nickname, Scabies. Ah, yes, scabies. The gift that truly keeps on giving you the worst itching you have ever experienced in your life. This is a gift that you do not want, and it is definitely considered a job hazard. For the next 5 minutes, give or take, I'm going to talk about the top 5 things to remember when and if you see scabies in your urgent care setting and what to do. These microscopic terrors can take months, even years, to be completely obliterated, depending on the patient and your treatment plan. They don't call it the 7-year itch for nothing. First things first. Number 1, identify the rash. We know which rashes can fool us and which ones can be really bad. A savvy clinician wouldn't miss something like, say, Stevens-Johnson syndrome, shingles, poison ivy or oak, measles, chickenpox, cellulitis, ringworm, erythema migrans, or even multiforme. Those are all pretty obvious. Once you see them, you never forget them. But the scabies rash can be easily confused with simple everyday rashes and missed. And if you miss it, that means more days of bites, more days of suffering, more days of scabs, and more days of complete night terror. Not to mention, if they invade in the summer months, they contribute to many missed bikini days at the beach. We would hate to miss Mel and his thong. When you see rash signed into triage on the tracking board, your light bulbs are flashing. You start looking at the vital signs, past medical history, what kinds of meds are they taking, or maybe they just started one. Are they a pediatric or adult patient? The wheels spin before you even set eyes on the rash patient. When you walk into the room and take a look, you can immediately rule out some bad things right off the bat. Is their face involved? Their mouth? Is there angioedema? Are they on an ACE inhibitor? What is the pattern? What's the distribution? Are they actively itching? Hives? Known allergy? Febrile? We could talk about rash identification for hours. But just for now, we're going to focus on scabies because it is really overwhelming for the patient, you, your department, and your staff. Not to mention, it can really affect your love life. I know a friend of mine who literally got a divorce because of their scabies. Now, we are uncertain if the divorce was because of the reason why the partner got scabies in the first place, or if the scabies made living together absolutely intolerable. Honestly, it may have been because of her cooking. It's hard to say. In any event, your quick identification of this skin disaster is paramount. This is what the patient is going to say to you when you see them. I can't sleep. The itching is driving me crazy. I tried Benadryl. I tried that topical crap. I tried a stiff drink. I tried a little leftover Ativan from my flight to Berlin. I can't take it anymore. I'm going to die from itching. You have to interrupt these patients and bring them back down to reality. Okay, Mrs. Jones. Tell me more about how this started. Oh, it's been a week. It feels like a year. They started around my pant line. Then I noticed the itching form these little patches like a line. Then, after about a week, I saw the bites and redness between my fingers and my toes. No matter how much I scratch, they just itch more. Okay, Mrs. Jones, are there any other symptoms? No, nothing. Well, I'm not sure how I got them either. I did volunteer at a homeless shelter about 3 weeks ago, and I thought maybe they were bed bugs, but that's when you know you have a case of scabies, and here is why. Scabies is a collection of only about a dozen mites on the skin that bury deep into the dermis and lay or deposit their eggs. Ugh, that's really gross. But anyways, they lay their eggs in various stages of hatching times, and then when their parents are long dead and gone, their offspring awaken and take over, starting the cycle all over again. And people become reinfected and pass the mites to others without even knowing it. This is why we treat the rash twice, and we'll talk more about that in a minute. The rash is worse around 3 to 6 a.m. when the mites are most active. They are late night creatures. It usually keeps people up at night. The rashes often itch so much that the patient forms bruising to their skin and sometimes open sores that result in a seriously bad cellulitis. The rash does not appear until 2 to 3 weeks after the person has come in contact with someone with scabies. The rash is usually red, pimple-like bumps that form in a straight line or S-shaped tracts with 3 to 4 bites grouped together. The most likely places for the rash to form are along the belt line, the waistline, the groin, the panty line, between the webs of the fingers, and on the wrists, as well as in between the toes. The rash should not go into the vagina or mimic symptoms of any STD. So number 2, identify the culprit. Who gets scabies? The answer to that question, anyone. There are certain groups of people who get scabies and some that are more likely to be reinfected. Scabies is most often spread during a relatively long period of direct contact with an infected person, such as maybe that of during sexual relations. One of the biggest issues is that it spreads when the person is asymptomatic and shows no signs of infestation. But any kind of close contact with someone, their clothes, their belongings, you can still contract scabies. Crowded living conditions such as those found in child care facilities, summer camps, groups in nursing homes, college dorms, prisons, all increase the risk for spread. Areas with a lack of access to water also have some higher rates of disease, so we're talking about homeless shelters or people living on the street. Crusted scabies is a more severe form of the disease. It usually only occurs in people with a really poor immune system, and people have millions of mites, and they're much more contagious. That is a rough one. And now we must warn you, it could be lurking in your pants right now. Number 3, who's getting the drugs? You've now been able to identify the rash and maybe even a population of people this particular outbreak is going to reach. It may be a nursing home or it may be a regular couple and their kids. In any event, everyone, and I mean everyone and everything has to be treated. That is clinical pearl number 3. Number 4, medications. What do we use? What about the off-label cures and home remedies? The first-line treatment is permethrin. It's a synthetic pesticide and insect destroyer that kills these buggers via neurotoxic destruction. It basically zaps those mites dead. It is incredibly dangerous to cats, birds, fish, and other mammals, causing seizures, tremors, and even death. But in humans, it's poorly absorbed by the skin, and it can be used to treat the scabies. And it treats them scabies good. The permethrin 5% cream comes in a tube, and the dose is always 2 tubes. Some street names for permethrin include Linclea and Nix. This is not to be confused with lindane, which is actually a hexachlorocyclohexane, which has been used both as an agricultural insecticide as well as a pharmaceutical treatment for lice. The World Health Organization even labels this stuff as moderately hazardous, and it's been banned in 52 countries. It's only ever used as a second-line treatment, if at all, and it's not recommended for the treatment of lice anymore. It's actually not recommended for scabies either. This is controversial, and people are still prescribing it. We're going to ask you not to, but that's just a recommendation. You can ignore the FDA and the WHO if you want. But first, hear me out. In 2002, the state of California banned the pharmaceutical, and then the Michigan House of Representatives passed a bill in 2009 to restrict its use to doctors' offices. You can read more about this on the Michigan legislative website. Even though recent studies of lindane show it can still be safe, the California ban was linked to fewer poison control center calls related to its complications and, quote, cleaner wastewater in the state of California. There are dozens of studies out there, but in even more recent news, in June of 2015, the WHO published a study in the Lancet Journal of Oncology where lindane was deemed, quote, carcinogenic to humans, and it was linked specifically to non-Hodgkin's lymphoma, i.e., just use the permethrin. And finally, number 5, what are we telling our patients to do? Consider some homeopathic remedies. They actually do help, and warn the patients of side effects, how to follow up with specialists, and what to avoid. You really want these people checking in with a dermatologist. I actually am going to go out there on a limb. I'm going to put my reputation on the line. I was given the gift of scabies. It didn't almost cause me to get a divorce, but I did lose an entire swimsuit season. That may have been a favor for the general public, but nonetheless, I am an expert on the treatment of scabies now because I actually tried it all. Some of the homeopathic things that helped me most were tea tree oil and a little vitamin E. I also used Benadryl around the clock, which made me insanely sleepy, but I was able to persevere. I went to the dermatologist 9 times, and I did the permethrin treatment 3 times. I washed every sheet in my house 400 times, and our water bill was $800. Not to mention, permethrin cream is $300 if you don't have insurance. Keep that in mind. Luckily, I have insurance, and it only cost me a whopping $150 for each treatment. I had to treat my husband, who never actually had any signs or symptoms. I went to visit my dad, and he kicked me out of the house. He never had to be treated either. Luckily, I beat the crap out of those little buggers, and they are no longer in this home. I had dreams about my house burning down because I itched so much that I started a fire. But that did not happen, and I was really happy that I found a plan that worked. And I'm going to tell you the secret of what actually did. Day 1 of treatment. Tell your patients to apply the permethrin cream from the tippy top of their neck, not their face, because if it's on their face, it's unlikely that it's scabies, and you may have to start over with your differential diagnosis. Cover every single centimeter from your fingers to your belly to your and down between your toes and heels. Put on some loose pajamas. Ask your significant other to sleep somewhere else for a week. I know that's tough, but you have to bite the bullet. Take 50 milligrams of Benadryl and hit the sack. You need to sleep 14 hours. Okay, so you're not going to be sleeping the whole time. We all know you have other things to do, but you need to keep the permethrin on for a full 14 hours. In the morning, take a lukewarm shower. Rinse off the permethrin and burn your clothes. No, I mean, put the sheets in the clothes and the mattress cover and your socks and your headband and your underpants and your sleep mask and your teddy bear in the washer with hot water and soap. Then dry them. Go do your thing. The 12 to 14 mites on your skin are now dead, but their offspring isn't. So for the next week, you're going to go to bed, wash your sheets every morning, and toss your used clothes in an area that is secure. I went directly down to the laundry room each morning and gave my neighbors all a show. In the evening, for the next 6 days, you're going to take a lukewarm shower or bath because any kind of warm or warmth makes the pruritus worse. Also, sleep in light layers because any kind of night sweating will also make it worse. I use Gold Bond lotion, Benadryl, tea tree oil, a cold pack to the really itchy areas every night. I also took an oatmeal bath each night with lavender, which actually has a lot of antiseptic qualities. That helped immensely. Then on day 7, I used the permethrin cream again in the same fashion. I still itched, and you know what? I still do. But like I said, it's called the 7-year itch for a reason. I put the house on lockdown for a whole week and only stayed in one room. I was confident that these things were not going to come back. But you know what? They did. And I had to go through the whole thing again. Sometimes them's the breaks. When I got them for the second time, I treated my husband. Some people do not show any signs or symptoms ever of the mites. So keep that in mind if people get reinfected. The partner can be carriers without symptoms. Also, when the permethrin is first applied, it can cause appetite loss, mild nausea, and general feelings of ickiness. Warn your patients of all these things. Finally, symptomatic treatment can be reached with applying Tefla pads with a thick application of Cloderm, which is a chlorocortisone pivalate cream, 0.1% to the affected area. Put this on just before bed, and it not only prevents itching because you are covered in a giant Tefla pad, but it helps treat the issue. Finally, if all else fails, you can take an oral tablet called ivermectin. Studies show it can wipe out the scabies gland. Studies are limited on homeopathic remedies, although some believe using a sulfur soap daily between treatments helps. I did this daily between my treatments, and I found that it made a difference. Benzyl benzoate is often used in the developing world because it's cheap, as well as sulfur ointments, but both smell really bad and are poo-pooed here in the U.S. My sulfur soap was scented with lavender, so you can suggest that to your patients. Crotamiton has been found to be less effective than permethrin in limited studies and may or may not help with the generalized pruritus. Camphor and methanol cream may also be a cooling aid for some. Crotamiton or sulfur preparations are sometimes recommended instead of the permethrin in pediatrics simply due to the concerns over dermal absorption and their side effects. Of note, my skin was really dried out. Warn patients that this may happen. If the skin gets irritated from permethrin treatments, Gold Bond or other lotions will help because the dry, patchy areas can often be confused with a reinfestation, when in reality, it's now just a contact dermatitis. Over-the-counter antihistamine creams may not be very effective and a waste of money. One tube is about $14. If you want to give a cream, go with the big guns, Cloderm, the 0.1%, or other high-strength steroids. Oral steroids are not needed. Antibiotics are also not indicated unless there is a subsequent bacterial infection. Final thoughts. Remind your patients their pets can't give it to them, and you can't give it to your pets. The scabies or mange that stray dogs and cats get is completely different. I wouldn't suggest they invite them in bed with them while their liver is away, but a hug here and there won't hurt. You know what else wouldn't hurt? Always wearing gloves and washing your hands. And if you can identify scabies early, stay far, far away. No, make the diagnosis, but keep a little bit of distance between you and that patient. Remember, you got to keep that room off limits in your ED for at least 3 days. There are some steam treatments that can be used, but the lifetime of scabies is about 72 hours without a living host. Ah, the gift that keeps on giving. It's a generous offer, people, but I don't want to be the next victim ever again. Until the next 5 and 5, keep it classy.